Good evening. This is Charise Karjala with Health Markets Insurance Agency at my office in Palm Desert, California. This question reads, will Medicare cover everything my current employer plan does? That's a great question. And it's pretty hard to answer without knowing how old you are, what your Medicare eligibility is, um, and what your options are within your finances. But I will say this, is that employer-sponsored plans or individual family plans have carve-outs or additional benefits that may be different from Medicare's. So in the case of some employer-sponsored plans, I think of Starbucks, for example, they have coverage for certain procedures that insurance companies and Medicare do not approve of, and it's considered to be an employee benefit. So think in vitro fertilization or some LGBT procedures. So those are two that would be covered, but aren't really appropriate for Medicare beneficiaries, if you know what I mean. So let me say this, is that Medicare at the end of the day, if you have Medicare in a secondary, which is a gap policy, there's no insurance company between you and Medicare. There's only you and the CMS regulations and Medicare to administer them. And as long as your doctor is doing the diagnostics and the coding correctly, there's no insurance company to say prior authorization or not approved or needs a second opinion or a flat no. If it's approved by CMS, the markers are all hit, you've got the appropriate protocol, then there's no reason for it to be denied. So the question, will Medicare cover everything my current employer plan does? Yes, and maybe more easily. So think about that one.